Welcome to another episode of COVID-19 Conversations, where I chat with experts and people from around the world about the latest developments in COVID-19. Today, I have with me Dr. Ong Hean Yee, a cardiologist from Singapore, who is also currently the president of the Singapore Cardiac Society. The topic today is cardiovascular diseases and COVID-19. Welcome, Dr. Ong.
Hi.
Yeah. In this current COVID-19 pandemic, there is a lot of news in the media about the higher risk that patients and people with underlying heart diseases in developing more severe form of COVID-19 and even dying from it. Share with us the latest evidence, the data from around the world in terms of implications and risk of COVID-19 on patients with underlying heart diseases.
This is an evolving situation, and the data is coming in even as we speak. The first tranche of data came from China, in particular Wuhan, and we saw that a risk of being ICU, if you have high blood pressure, diabetes, or heart disease, is much higher. And if you're in ICU, the risk of you put on a life support machine and dying, again, is higher if you have heart disease, hypertension, and diabetes. This is not much different from, let's say, influenza or the original SARS as well. But for this COVID-19, the effect appeared to be much more pronounced compared to our experience with influenza or SARS version 1.0.
What are the ballpark increased level of risk for even dying from COVID-19 for people with underlying, in this very broad category of cardiovascular diseases, the risk that they have of severe diseases as well as the mortality rate dying from? Of course, we know that in different parts of the world, when they have a severe outbreak, their healthcare systems are overwhelmed and the data is different from different parts. What is the ballpark from around the world, roughly?
Probably the best data is from Wuhan. The baseline mortality rate of death for someone coming into hospital is about 7%. So this is baseline mortality rate of someone coming into hospital. But you must be aware that when this was happening in Wuhan, the hospital systems were a bit swamped. And only people who are quite sick were actually hospitalized. If you have heart disease and you were hospitalized for COVID-19 in Wuhan, your risk of dying is doubled from 7% to about roughly 14%. And they will actually screen for evidence of heart damage or myocardial damage using a blood test called troponin T. And if you have evidence of myocardial damage from this COVID-19, then your risk of dying is actually times 10. It's quite a big number.
Yeah, we were just sharing just now, right? There are different studies that are beginning to be published, right, including those from the US and other parts of Europe. So certainly for the people listening in, the bottom line is that people with underlying heart diseases are at higher risk of developing a more severe form, developing complications, and even dying from COVID-19. That's the key point, right? Even if it's 2 times or 5 times or 7 times, actually, it's not that important. What is important that you are going to be at higher risk. So I think that's something that we know, and that's something that we want to highlight to everybody watching this video. When someone contracts COVID-19, many things can happen to the respiratory system, to other parts of the body. Maybe you can highlight some of the cardiovascular complications that potentially happen in COVID-19 patients.
The rationale for the cardiac involvement in COVID-19 is that the COVID-19 attacks this receptor called ACE2 receptor. And this ACE2 receptor is found in quite a lot of organs actually, including the gut and of course the heart. It's found in quite large amounts in the heart. So there was always a risk. We knew that from the coronavirus outbreak in 2003. There was also another outbreak in Amsterdam in 2004, 2005. Called NL63. All this family of coronaviruses attack the ACE2 receptor. The effect of this coronavirus attacking the ACE2 receptor is firstly direct myocardial damage. That means the virus invades the myocardium or the heart muscle directly. And of course, when the virus bursts out, the muscle will die and you lose some of your heart function. The other effect is that the arteries supplying blood to your heart. And if you disrupt the lining of the arteries, then there's a propensity to form clots, both within the venous system as well as the arterial system. We had a case presentation last night with doctors from Ng Teng Fong and Khoo Teck Puat Hospital, and they showed us very interesting cases of clots forming almost spontaneously within many blood vessels within the
including the
body,
femoral arteries.
including big arteries like femoral artery, exactly,
Yep.
which you don't normally see
Yep.
in a heart attack.
With COVID-19 patient, the cardiovascular complication they could develop actually, very pervasive, in all the different organ systems, from thrombosis and including getting heart attacks. Is there this question mark when someone presents with a heart attack and they are COVID-19 positive? Is that one of the challenges that you face? This patient have a heart attack and incidentally, he or she also has a COVID-19, or did the COVID-19 precipitated triggering myocardial infarction?
The second question is much harder to answer. Let me answer the first question first. If your background prevalence of COVID-19 is very high, for example, you have, let's say, 20,000 young men with COVID-19, there is always a percentage or small chance that one of them will have a heart attack over a period of 1 or 2 months. Now, this brings you to the second question, which is whether COVID-19 has increased this rate or not.
Yep.
This one a bit harder to answer the question. We have to go back to a concept called a stochastic event. That means a random event. So for example, if you're driving a car, there's always a chance that you have an accident on the day you're driving.
Yep.
Okay, there's always this chance.
Yep.
It's not zero. We know it's not zero.
Yep.
If it's raining, if it's very dark, if you're speeding, the chances will go up.
Yep.
Now, can you say that because it rained, because it was dark, you had an accident that day? It's a bit difficult to say that. So this is a very almost philosophical - nebulous concept that we have to grapple around. Okay, I'll try to answer the question now. So I diverge into philosophy a bit.
Low risk, yep.
The question is, has COVID-19 increased the risk of someone having a heart attack? This is a bit more difficult to answer. We don't have the data at the moment.
Yep.
To get this data, we will need to look at the number of heart attacks in February, March, April in Singapore compared to the number of heart attacks we have in 2019 or let's say 2018.
Yep.
We're still trying to gather that data via the Singapore cardiac database with my colleagues actually. But until we have that data, it's going to be very hard to prove that COVID-19 has so-called increased the risk of heart attacks. At the moment, the cardiology community suspect that there is a increase in risk. We think there is an increase in risk in people who are already, let's say, at risk. Let's say
they have an underlying ischemic heart disease. They are more likely. There's a likelihood, at least theoretically, that if they have COVID-19, that may trigger an escalation and events that will lead to a heart attack. Right. So that sound very plausible, but as medical doctors, as we in the medical community, we don't go by what is likely theoretically. We need to go by data, right? And that's what you are saying, right? The evidence, so the data that we collect. And because we are still very early, although we have 5 million cases from all around the world and more than 300,000 deaths as a result of COVID-19 all over the world, the data on specific questions that we are trying to tackle, right, they are only just coming in. We don't have the full data that there is a possibility that this is happening. The reality is it is almost immaterial to a person with underlying heart disease. The reality is that in this time of COVID-19, they are higher risk of a very bad outcome or worse outcome than the average person should they develop COVID-19. I think that at the end of the day is the most important point of all of this. So with that, let me go on to this question about, are you seeing whether in the Singapore context or around the world, papers being published that are people delaying seeking medical attention because of the fear of going to the hospital and the consequences and the implications of that decision to delay seeking medical attention when they suspect that they are having a heart attack?
For us, Cardiac Society and our cardiac ecology community, this was a very serious question we asked very early on. Are people not coming to hospital when they have a heart attack? Let's talk about the data from New York and Italy first. 100%. There was a huge decrease in people coming in with heart attacks in both New York as well as Italy. Now, is it possible there are less heart attacks during this COVID pandemic? I think very unlikely. And in fact, the Italians have a very good database of this area called Lombardy. And they found that within Lombardy, there's less people coming in for heart attack to the hospital, but there's more people dying outside of hospital.
Yep.
So that's very worrying.
Whether they are COVID-19 positive or not, actually not important. But many of them are dying, from heart attack outside of the hospital.
Suddenly.
Suddenly.
Yes, and the numbers just shot up once the pandemic was happening.
Yep.
So that's very worrying. Okay, for Singapore, anecdotally, when I talk to the lab directors, for example, Khoo Teck Puat Heart Centre or Tan Hock Seng, they all say that the numbers dropped slightly, but it was maintained. So I think this is Singapore's approach to COVID-19 probably helped. There was a gradual lockdown. There wasn't mass panic. The health system was not swamped. And so when the health system was swamped in New York and Italy, and people started to panic, and there was no clear direction from the local leaders, then we see this phenomena.
I think it's a function of the local situation in different parts of the world.
Yes.
Right? How their healthcare systems were able to manage or not. And also the media. Right? Imagine somebody developing, they think I'm having a heart attack, but not sure. Right? But you see scenes on TV, on social media, right, of people, of the very scary situation in the ICUs in Italy, in New York, and also a person in those places, developing what they think maybe not, right, having a heart attack. They would be quite hesitant to immediately seek medical attention. But in the Singapore context, for example, I think the healthcare system is still managing well, right? And the people's confidence in the healthcare system is still high, right? So when a person develops symptoms of whether they had underlying heart diseases before, underlying coronary artery diseases that they know, right? They are less hesitant to immediately seek medical attention. But regardless of where they are, whether they are in Singapore or around the world, and if they develop some very abnormal, significant symptoms and suspicious of a heart attack, should such a person delay going to the emergency department, delay seeking medical attention? What are the consequences? What are the implications of such delay?
Certainly, patients who have symptoms should never delay seeking medical attention. For heart attacks, the symptoms can be very misleading, very subtle. The problem is most of us thankfully have not had a heart attack before, and so we will not know how it feels. A bit of public messaging here. First of all, heart attack pain usually is not severe. We normally see on TV severe chest pain. Normally that's not the case. Of course, if it's severe chest pain, is obviously something is wrong.
Yep.
But most of our patients with heart attacks do not have severe chest pain. The other thing is that we found when heart attack patients talk to me, they tell me that they have sweating, a cold sweat, or breathlessness. The third one is the duration of the pain. Heart attack pain is almost never just 1 second or 2 seconds fleeting pain. It's never like that. Normally, the duration of the heart attack discomfort or whatever the symptom is normally about 5, 10, or even 20 minutes. Beyond 20 minutes, you start to feel very unwell, you feel breathless, and it becomes very obvious something is wrong. The fourth thing that's quite important is actually the location. Although most of the time it's on the left-hand side, it can be on the jaw, can be on the shoulder, arms, or even on the right-hand side or the back. So the location can be different depending on each person. But if you had a heart attack before, and let's say your heart attack discomfort or pain was on this side, if it happens again, most likely it will be on the same location. But if you never had a heart attack before, I can't tell you how your heart is wired.
Yeah. But in the delay, what's the implications on the prognosis or surviving the heart attack, right? What is the implications of any delay in seeking emergency treatment?
Heart attack is scary for us because about 1/3 of patients actually do not ever come to hospital. So out of 100 heart attack patients in Singapore, we think about 20 or 30 of them will never see A&E or see any of us. They just die suddenly at home or when they're walking in the park.
Yeah.
If you don't seek treatment, the historical data from the day before we had cardiologists or before we had ICUs is that out of 100 patients, 20-30% will die straight away. And if you don't seek attention, another 20 or 30% out of the 100 will again die within a few days or a week or so.
Yep.
If you seek treatment, our national database, we actually track it very rigorously. The mortality for heart attack in Singapore is actually very low, about 1% or less actually. which is quite good.
And the relationship between how timely a manner they seek medical attention, there are different types of heart attack. So for the general public, right, actually it's immaterial, not important to really know the medical scientific categorization of different kinds of heart attack. But especially in certain types of heart attack, how quickly they get to emergency department, how quickly that they go and seek medical attention actually determine whether they survive the heart attack or not.
Exactly. I didn't mention it just now, but for the worst form of heart attack called a ST elevation MI or STEMI,
Yep.
which essentially is 100% acute occlusion of the artery, the mortality is about 10% per hour. Every hour you delay, your risk of dying is
Yep.
another 10%.
Yep.
So, and that's why all our cardiologists, the labs, the hospitals have a KPI of trying to get a door to balloon. That means you come in a heart attack, you walk in through the door,
Yep.
we want to put a balloon and stent in your heart within 60 to 90 minutes, within 60 minutes, if possible.
Yeah, so certainly the message here is it is understandable around the world, especially in places where there is a very severe outbreak happening, the hospital systems are being stretched. But should you suspect that you are having a heart attack, you should still not delay seeking medical treatment. I think that's a message that both of us are trying to reiterate and reinforce through this video. Perhaps the next thing that I want to cover would be, what would be this general advice, right, that you would have, right, to your patients? I mean, your cardiologist, all your patients would have some form of cardiovascular disease, right? And we know that COVID-19 is not going away anytime soon. Matter of how severe or not severe it is at any point in time, but it's going to be around for a bit of time, right? What would be any general advice that you give to all your patients with cardiovascular disease?
It's all about risk. You want to reduce your risk as much as possible. You need to exercise. You don't need to run. You don't need to jog. You don't need to sprint like Usain Bolt. Walking at a steady pace with your mask on for 30 minutes a day is more than enough to maintain your what I call cardiovascular health. So exercise. Second is weight. For Asians, the ideal BMI is definitely less than 23. In fact, the best optimal risk for an Asian is actually between 18 to 21 BMI. But I know it's very hard to get 18 to 21. But try to get at least less than 23. So exercise, weight, smoking. Smoking is a low-lying fruit. It's bad for you. Everyone knows it's bad for you. I don't need to say anymore. And of course, what you eat. There are no superfood. We don't believe in the superfood concept.
Yeah, I totally agree. You know, we should be looking at the whole of a diet, affecting the whole of our body systems, or whole of health in our whole lifetime. So often when people talk about diet and health, they start talking about miracle cures, superfoods, you know, and I totally agree with your statement there. Yeah. What other things that you would advise, you know, especially during this COVID-19 pandemic, right? Your patients, you know, to try a little bit harder during this period.
I think definitely watch what you eat. In fact, the first time I met you we were talking about food.
Yes, absolutely. I still remember, right? We got connected over our common interest in the dietary habits of communities, of patients, you know, on their health. You know, that's why we got connected, and we are still connected today. Yes,
that's right. I think if you already have a pre-existing disease, like high cholesterol or high blood pressure, please do continue to take your medicine. That's very important.
So certainly in this COVID-19, let me make sure you don't miss the opportunity to communicate to people out there with underlying heart diseases, underlying cardiovascular diseases. For everybody else, but becomes even more important for people with heart diseases, is to prevent getting COVID-19 in the first place. Right? So although it's relevant for everyone, it becomes even more critical, more important for people with heart diseases. You know, wearing a mask, social distancing, you know, personal hygiene. We cannot emphasize that enough. Right? We cannot emphasize that enough. So that's one. But second one is that there's no better time than now, or no other better reason to start getting the house in order in terms of lifestyle and diet. right, to better control your heart diseases, to better control your various risk factors contributing to cardiovascular diseases, through whether it's lifestyle, diet, exercise, right? Because at the end of the day, prevent yourself from getting COVID-19 as much as you can. And should you, in the event of contracting COVID-19, right, you want to get out of it well, survive it, have as little complications as possible, and certainly, having your various medical conditions under control is certainly going to help in that.
Exactly. The hospitals in Singapore, especially the public hospitals, they are ready to look after patients coming in with acute heart attacks. If you see them wearing the N95 and goggles, don't be scared. They're just trying to protect themselves so that they can continue to be healthy and look after the next patient that comes after you. That's all.
Certainly, I think that's a point worth repeating and reinforcing, right?
Yeah.
Because I think that this general fear, not just in Singapore, but around the world, right, about going to a hospital, to get certain essential health critical procedures or diagnostic done. But I think the context must be, we are now a few months into this pandemic. All right. And although it was only officially declared in March by WHO, right, the whole global medical community already knew about this and was starting to learn more, ramping up, putting measures in place in the hospital. Now it's May 2020. It's many months since the pandemic, and most of the hospitals around the world are now a lot better prepared than before, right? Not just in managing COVID-19 patients, but also preventing the non-COVID-19 patients from accidentally getting infected with the COVID-19 whilst in hospital. So I think that's a message I want to get out there as well. Of course, every local healthcare system is different, right? But certainly in Singapore, certainly in other parts of the world where the healthcare system is still managing well, the risk of contracting COVID-19, right, when you go into hospital for non-COVID-19 health matters, is a lot lower now than at the beginning of it.
Definitely safer than going to a bar.
Absolutely. I mean, it's all about relative risk. Yeah.
Yes.
So thank you very much, Dr. Ong. Right. So for today's topic, right, I think the message here is very clear. Right. If you have underlying heart diseases, your risk of developing a severe form or even dying from COVID-19, right, is going to be much higher. So now more than ever, people with underlying heart diseases should do everything you can to prevent yourself from contracting the disease, right? And also to do everything you can to get your condition under better control. Yeah. So see you around for the next episode, and thank you.
Thanks, Dr. Chan. Keep safe.
Thank you.